Ladies and gentlemen, welcome to another episode of Physios and Friends from around the world. I'm your host, Dr. Imrul Kabir. Today, we have a very special guest. Eza Chowdhury started her career as a financial planner. Then she went on to train to become a yoga teacher and an energy healer. She has been practicing yoga and energy healing in Dhaka for the last couple of years. We met in Bali 2 years ago and we have conducted a workshop in Dhaka. I'm very proud and honored to welcome my friend, Miss Eza Chowdhury. Welcome,
Thank you.
Eza, to the
Thank
show.
you. I am honored to be here. I'm honored that you took the time to spend this time with me to be able to share this knowledge with everyone.
So, Eza, tell us what motivated you to come into the field of yoga and meditation.
So, I have been practicing yoga for many years. I've been practicing for about 17 years now. And my the reason why I ended up in yoga is out of curiosity. Why do people call yoga spiritual? When I say I was practicing yoga, I was practicing what is actually a small part of yoga. It's asanas, ashon, or it's a physical practice. But I wanted to know, how does that connect to spirituality? So I was on, as you mentioned, I was a financial planner for a decade in the financial industry. And I was between jobs and I was on vacation in Thailand with my family. Somehow I felt like this was my one chance where I had some time in between. I joined a yoga teacher training in northern Thailand. And my question was, I wanted to know, why is it called spiritual? And by spiritual, I mean, how does it connect? Do these yoga practices connect to your soul?
Mhm.
But there was something in between that was missing, and that was the brain.
Okay.
And the brain is the master brain, and that is mastermind. That is what controls our body, what controls everything else that goes around.
That it should, and also about energy healing. This is something of a new trend or concept in Bangladesh. When you started your practice in Dhaka, were there obstacles that you were facing when you first started about 3, 4 years ago?
Yes, there were. There weren't really any yoga schools or yoga studios that had internationally trained, recognized teachers. And we were the first in Samadhi to have teachers that were all advanced level trained. And, knock on wood, we still have them running virtually. And we also
Mhm.
have, now we have, hopefully we'll have teachers from around the world. There were, yes, 6,000 years ago, yoga came into existence, but it only surfaced about 50, 60 years ago that the world started to know about yoga. A little bit of a background of that. Yoga includes energy healing. It includes meditation. That's a very big part of yoga. And so are things such as your breathing practices. As a matter of fact, it goes much more basic than that. Yoga begins from how we live our lives. It's about truthfulness. It's about ethics. It's about honesty. It's about non-stealing. It's about non-violence. That's where it begins from, your morals, your personal ethics.
Mhm.
And then it goes on to asanas and meditation. Asanas are your physical practice, and your meditation, your pranayama, and the ultimate goal is to reach a point of bliss. Now, from there, what happened was a few decades ago, Westerners had taken one part of yoga, which is asanas, ashon, or physical practice, and they started practicing this in North America or another Western world, and it started to become very popular. What became popular were more about flexibility. It was more about flexibility. It was about immune system. It was about better sleep, et cetera, et cetera. And I'm very grateful that these wonderful teachers did such an amazing job to make it that popular. And this is how we also ended up with a yoga studio in Bangladesh. But yoga is much more than that. So when we go deeper into understanding what that really means, it's not a workout. We say it's a work in. So you work inwards into your mind and into your heart. How that's done, the techniques that we use, is what makes it very, very fascinating. And not just fascinating, it's extremely insightful for those who do practice yoga on a regular basis. We're not just trying to become fit. We're not just trying to build the muscles on top, not just, a six-pack or four-pack or muscle, growing your biceps and triceps. That is always there. If you do the right kind of yoga, that's always there. But we want to go deeper than that. We want to connect it to the mind. We want to go deeper than the mind and connect it to the soul. And the techniques of how to get there is what increases your curiosity, whether it's as a teacher or it's as a student. There are many students that I have, or perhaps I'm friends with, or they have been in my classes, that they've never done a yoga teacher training, but they've gone very deep into their practice. And it all comes from accepting the fact that we're not just there for the physical practice. We're there for much more than the physical practice. And that's when when you heal from the inside, is when you slowly start to blossom and you start to show the happiness on the outside. And that is really what we're going for. So in Bangladesh, there was a big confusion as to what yoga is, as is in most social media or in most countries, that we think yoga is about flexibility. It's about turning into a little pretzel or sitting in a cross-legged seated posture for half an hour, 1 hour. So it's not for me. But what we are teaching there is it's a blend of everything, and you choose what you are ready for. And you begin with the body, but then slowly, as you have taken care of the body, you start to notice the difference that it makes in your mind, the difference it makes in your immune system, the difference it makes in your sleep, the difference in your relationships with others. So this is how you measure if your yoga is working, not from the fact if you are, if you're looking better. Of course, that always comes, and that comes from the inside. But you measure yoga by, how am I doing at work? Am I feeling happy? Am I content? No matter what is thrown at me in life, am I feeling like I am working towards something that is satisfying? How are my relationships doing? All of these, at the end of the day in our lives, is not just about what people want us to feel or what we have to reach because we live in such a competitive world, but it's about how you see yourself, how you empower yourself. And that is slowly what we're trying to bring back in yoga, that your yoga studio, Samadhi Yoga, or anywhere else, should be a place. We should be welcoming everybody. It's yoga for everyone, whether you're a child, whether you have an injury or back pain, or whether you're obese or you are anorexic. It is something that should be welcoming for all.
Yeah, you are right. It should be all inclusive. I mean, regardless of their body composition or about their health condition, because yoga can help in every situation. And I learned more about yoga just a couple of months ago through a group led by Mr. Sri Chinmoy. He died in the 80s, early 80s. He was actually an immigrant from Bangladesh, from Chittagong, who emigrated to New York in the early 60s. And he formed this group, and the group still exists. It's a big group. And as you mentioned earlier, it's not just practicing body movements, but it's a way of life. I see them, they have a different kind of meal plan. They have a different way of life. They live in a different community because, again, they want to live as organic as possible in their little community that they have built throughout these years. And that's how I learned that yoga is not only about movements or breathing or meditation. It's a way of life. It's about how you eat, how you dress, what you do in your day-to-day life. Now, also, it is slowly become common in physical therapy practice to complement yoga with other treatments that we do, especially among very young children who have mental condition or autism or who have ADHD, or with elderly who'd like to improve their flexibility, their breathing, uh, if they have joint pain, joint ailments. So slowly we are incorporating more and more yoga and other holistic techniques. Now, about the energy healing, can you tell us more about what exactly is done and how the session looks like for energy healing that you do?
So different kinds of energy healing are different. Now, a lot of your energy healers will use different techniques that they have, whether it's Reiki or chakra healing or
Mhm.
crystal healing, intuitive healing, et cetera, et cetera. There are many different kinds.
Okay.
Um, Typically, what we would do is we would sit down with a potential client and we would talk to them. We would talk to them, uncover what is on their mind, what brought them to be sitting in front of myself,
Mhm.
um, and then try to figure out what kind of healing would be best for them, or if it should be a blend of all. So
Okay.
that is something just like you as a doctor, you sit down with your patient, you uncover, you diagnose what the problem
Mhm.
is, and then you write your prescriptions. Just like that, we first sit down with the clients, we find out what the issues are, and then we start to find out what kind of healing they're looking at. Now, typically, it would be, it's going to be, if it's one-on-one, if it's not a group healing session, then you sit down and whatever the healing may be, you're spending that time with that other person. And
Okay.
Reiki healing, for instance, it's to do with the hands. So we use our hands on top of the person's body
Okay.
intuitively. That being said, what is most important here is your trust that you have with your energy healer.
Mhm.
How comfortable do you feel? And how open you are. It is a matter of the mind. I cannot force anybody to sit in meditation, but that person needs to come. That person needs to be open to it. Just like that, in your energy healing, you have to be having that, feeling that bond with your energy healer. You
Mhm.
have to have that trust in order for you to open up so that we can explore your energy. We can start to explore, we can start to slowly heal, help you heal. At the end of the day, you're your best healer. You have to open up. We're only there as a guide. I will probably just guide you through a process. I will try to speak to you in order for you to let it out. But if they're too close, I'll give you an example. If a client is, they're not ready. They're not ready to address their vulnerabilities or perhaps a loss or a grief in the past. Maybe they've lost somebody in their life. Maybe it's a person, it's money, but they're in denial. Maybe in that case, it might take some time. But I want to address one thing here is we live in a world of where we're constantly talking about positivity. But what I want to point out is positivity is great. Wherever your energy flows, wherever your attention goes, is where your energy flows. But we cannot have fake positivity. In order for you to really go into the path of where you find bliss or you find your way to peace, you have to take care of your demons in the past. And you have to look into the eyes of your demons or be strong enough, or perhaps you need a healer to help you go through it in order for them to subside, in order for you to be able to move on. So it's not where you cannot possibly be 100% every day, 24/7. You cannot be positive. There comes a time when you have to deal with your demons, you have to deal with your trauma, you have to deal with your stress, you have to deal with blockages that is holding you back. And this is where an energy healer comes in. We help you through that process. You may not be ready the first time. You may not be ready the third time, but you may be in the future. Or perhaps it's not what you think it is. You may think it's just stress, but maybe it's something from when you were a child. Perhaps it's something beyond what meets the eyes. What we see in the conscious mind, we may have triggers. So you are standing in line in a grocery store and someone cuts you off, right? Someone cuts you off and that's a trigger and you just want to yell and scream, right? Well, where is that anger coming from? That's what we need to go back to. That little things like that, we should be able to think, okay, this person perhaps is having a bad day, they're in a rush, or maybe we want to be a little judgmental and say, okay, they don't have the manners. But whatever it is, if we're losing our cool there, that is not what's causing it. This is just a trigger. Maybe we have had many events like this where we felt like we were being cut off. But here, instead of you having that meltdown, if you had removed your blockages, if you had removed any kind of fear or so that you've had in the past, this will not cause a trigger. And that is what we want to do. We want to consciously be able to address our fears, our blockages, our trauma at a time that is good for us, instead of having a meltdown at the wrong time. And that is really what we're going for, is that person, the client, when we're sitting across from the client, and it's not an easy job, as in for the client himself or herself to open up. So this is why I always, take the time to get to know them. If they feel the bond, they will open up. They have to feel the bond with you. They have to feel the trust with you. And when they start to trust, they have to open up their energy. And when they open up their energy, we're working with the subconscious mind and the conscious mind. The conscious mind is your mind, your brain that we work with. And there are 11 major organ systems in our body.
Mm-hmm.
Your lungs want to breathe. Your heart wants to beat. But it makes no sense to have any of those beating or working if your mind isn't connecting to them. That signal or that order is coming from your mind. It's coming from your pituitary gland, etc., etc. But really, this is why we call this the mastermind, because everything comes from the brain. So we are dealing with the brain, but there are a lot of things sometimes we suppress that is in the subconscious mind. But in order for us to get to the subconscious mind, first we need to work in our asanas. We need to work with the body, that's your body. Then we work with the mind that can send the signals to different parts of your body so you can sleep better, you can be happier, you can move ahead in life, etc., etc. But then we also want to go into your subconscious mind that sometimes suppresses a lot of the negative events that have taken place in your life. Perhaps you didn't have the time to deal with it. Maybe you've had a death in the family that you just did not have the time to sit down and grieve over. Perhaps you went through a divorce, or you went through a loss, or perhaps you've had trauma from when you were a child. I mean, we're looking at cases in Bangladesh. There's so many rape cases that are now surfacing. The mental health of these people should not just be dealt with what they're facing at work. It goes back to them dealing with, and these are very, very brave men and women that are coming forward speaking about it. And, hats off to them. But this is when they are dealing with much more than what they were for all these years. And that is what we want to go into. Once we have dealt with it, we can move forward. There are a lot of blockages that we feel. And in order for us to feel that beauty or that happiness from the inside, we have to find the connection of the body with the brain to our spirit.
Well said, Isa. I mean, I experience the same thing with my patients in my practice. I see a lot of them, they go through a lot in their lives, and that affects their perception of pain, that affects the pain level, that affects the pain in turns affect their functional level. And then there is something what we call myofascial pain syndrome, where the muscles and the fascia are so tight and so connected that it's very difficult for us to even treat that kind of pain. And that starts with stress, with depression, with anxiety, and with so many other issues that you just mentioned. Now, the problem that I see with the modern medicine is that, like for us, physical therapists are seeing just the physical being and not the person as a whole. And so then what happens is that we can consult the patient, make them aware of the cause of the pain. It's not just physical, but it's also psychological, mental, and help them, guide them to seek consultation by a psychologist, for example, or a counselor. But the but then the problem is there that we are treating just one aspect of that pain. He's treating a different aspect, I'm treating a different aspect, but we're not treating a person as a whole. So that is the reason why sometimes I feel like that the same patient is coming back to me over and over, month after month, year after year, and each time they come with more intense pain, more health issues, pain in different area of the body. So again, as you mentioned, that seeing a person as a whole, mind, body, spirit, treating a person as a whole, that is the way to properly address this issue, and again educating and making them aware that these are the issues that they are having. Sometimes they're not even sure, as you mentioned, that they think that it's just stress and nothing else, but it could be something related to their past.
That's a
Now,
very, very profound observation. That's a very profound observation.
and I see that it's just that there's so limited that we could do in modern medicine and what the insurance allows us to do in clinical setting. Now, Isa, where do you see the future of your practice or the future of alternative medicine in Dhaka, especially in Dhaka, Bangladesh?
We're taking one step at a time. So we've come a long way from just a year and a half ago when we started as just a yoga studio. In the yoga studio, the goal at first was just to have teachers for all levels um, that were that were connecting to their students, that were not just very highly qualified, they were not just advanced level trained, etc., but they had that connection to each of the student. That when you came in, you felt safe. Now we're going more into holistic healing. We are working with partners such as clinical counselor, Reiki healers. We're working with astrologers. We're working with Ayurveda. And that is what we're trying to go towards. It all depends on how you connect to our services. And not everything is good for everyone. Again, it's about customizing. We cannot have one size fits all. It's not that this shirt is going to fit everybody. We have to we have to sit down, we have to find out what your needs are and then suggest accordingly. We want to be able to, again, going back to what you said, that we want to be able to be a holistic center where we're not just dealing just with the body. It's not where we're having classes and we're constantly posting about handstands and turning into a pretzel and etc. But we want to be able to be a place where you come in and you feel safe. Um, if you call us, that we listen to you and we can make you feel comfortable enough that you trust us to go beyond just the body. You know, you can be doing you. We often hear of people that are healthy, as in they look fit, they go off runs every day, they eat healthy, but then all of a sudden you'll hear that they've had a stroke, or they have paralysis, or they've had diabetes, or they have high cholesterol. Where is all this coming from? Is it the food? Is it because they are trying to get by in life by suppressing the trauma that they have had? Is it on a constant basis that they are putting up with a lot of stress, perhaps because they have not dealt with a thing in the past? Maybe they're non-confrontational. Maybe they have a problem with confronting people, and that might have developed since they were a child. They were probably bullied, and now they have a hard time, which is why perhaps at work they're not able to communicate what their problems are or communicate with their family members. So we want to be a center where we address the body, the mind, and we want to be able to reach out to something a little bit more beyond that. So we want to be able to go beyond just the body. And that is done through quieting the mind. And it's not, for personally, and I'm sure a lot of people will agree, one of the hardest things for me in life is sitting down and meditation, is quieting the mind. Because our mind it's racing all over the place. We have work. You know, I've led, you started the conversation off by saying, I used to be a financial planner, and those 10 years, I never had time to grieve. I've lived that life, you're running from work and you're running to your yoga class. And I've kept that in mind every time I'm in yoga class and I see someone rushing in. They're probably, they're perhaps 2 minutes late, or maybe they're coming in early, but they're having a hard time balancing. And that balancing comes from the mind. We want to be able to make you feel like this is your space. This is the space you can completely let go. The way you connect to your mind or quieting the mind is when you anchor into your heart. Anchoring into your heart is when you start to relax. And it's much easier said than done. Much easier said than done. That quiet your mind. If I just tell you quiet your mind, it's not that simple. To tell you, hey, go relax. That's the last thing you're going to do if I ask you to relax. But the process that we take you through, how to release what you're holding in your body, is what we want to teach. You mentioned clients that come in or patients that come in year after year or month after month, and perhaps they have a pain or fascia muscles that you're dealing with, and you don't really see much progress. Perhaps the progress you do see, and you're doing everything right, but the progress that you do see is perhaps temporary, and they keep coming back. Initially, they might meet with you and they might give you, a wonderful review that they felt amazing. But 3 months later, you're looking at them thinking, how did this come back again? It's because we need to address something beyond just the body. We have to go beyond just dealing with the muscles on top, because these are layers. We need to peel off the layers. You mentioned fascial muscles. So in everything that you face in life, your body, your muscles, they have memory, your connective tissues, and it holds it there. So sometimes we'll notice that even in yoga class, people start to feel emotional afterwards. And that's because whenever we feel that tremor, or you feel anxious, or you feel stressed, we start to hold it in our shoulders. Right. And then as soon as you hold it in your shoulders, it starts to shoot that signal to different parts of your body, perhaps to your liver, maybe to your pancreas, maybe to your legs, maybe your back, that you're holding tension. So it starts sending those signals to different parts of your body. So the first step to actually take care of it is what you're doing, is you're taking care of the client's body or the patient's body. And that is also how we like to do it too, is through the asanas. You pick an asana class, an ashram class, physical practice class that is right for you, whether you're a beginner, whether you want to do yoga cardio, or whether you want to do kundalini yoga, whatever it is. But we start with the body. Once you start addressing the body, you start relaxing the muscles. As soon as you start relaxing the muscles, that is when the emotions, they begin to surface. And then we start dealing with the emotions. And it is a practice. It is not something you can do one day. Perhaps you'll have a breakthrough. Perhaps you will take care of some of the biggest trauma in your life. But then life doesn't stop there. We keep moving. You're still going to be going to work. You're still going to have to deal with your kids and your family, and you have stress, and then you have COVID, and then businesses shutting down and then starting up again. Perhaps you're starting a new business. It goes on and on and on. So this is why it's not something you just do in one day and then you're a perfectly new person and then you're okay for the rest of your life. It's a practice. Just to keep showing up to your practice.
Right. Now, Eza, we're almost out of time. My last question would be about telling us about your memorable experience during your practice. When I did a class with you, I remember that was in 2019, I believe. It was about lower back pain. And I remember a couple of members who came in and they either had much less pain or almost no pain after practicing some of the asanas that you've been teaching them at the center, and it's working for them. And these are very similar exercises that we do in the clinic, especially moving the back, the spine, backwards in what we call extension position of the spine. So now, tell us what memorable experience or success stories you have at your practice. And there are a lot, I know.
Very humbly, yes, there are lots, which tells us that that sometimes some things work And really, again, it's about the connection to your students or to your clients, how much they are opening up to you. But I want to give a personal experience, and that was maybe the first time that I had probably noticed. I had been trying, like I mentioned, like I had been doing yoga for many years, and I had been trying to go into a wheel pose. If you're familiar with the wheel pose, it's basically a deeper back bend. And I have been struggling for many years. Now, I would show up to my yoga class. This is back when I was a practitioner and not a teacher. No matter how difficult or how packed my life was, I made it to my yoga class. And I loved it. And I've been practicing to do a wheel pose for a long time. I had a very hectic schedule, and there was always a lot on my mind. I had a very difficult time balancing. I try to tell my students this. I don't know if half of them believe me or not, but I had a hard time even standing on my feet just standing still on my feet when I first showed up to my yoga class, in Dandasana or in Samasthiti, if you're familiar with the names. And slowly it would start to relax you, and then you had better balance. By the end of the class, you had better balance. So anyways, I've been trying to do this wheel pose for a couple of years. And then one day, I finally decided that was the first time I was going to quit my job. But I was just in the process of quitting my job. I knew that it was slowly coming, so I had taken a week off. I was on short-term disability. I had anxiety. I'd been home for about a week. So it took a lot out of me to be able to detach from work. Because a lot of the time, and you'll hear this very often, they'll say, no, I don't have time for yoga because I have work.
Right.
Well, the truth is, you wouldn't have work if you don't have your health. So, and that is, again, it's attachments. We think we are dependent. We think they're dependent on us, but a lot of it is our attachment towards them. It's our dependency. Anyhow, so a week of being at home, I go into yoga class, and without me even trying, somehow it just comes to me, I go into the full wheel pose.
Wow.
And I was so calm and I was so connected at that time that I didn't even notice until 5 seconds later that I was doing the full wheel pose. Of course, I felt great, but that told me something. That told me I went into the wheel pose, not because I was trying too hard, not because I had been pushing myself, not because I was being competitive, because the person next to me was doing it every day, but because I was relaxed. I was connected. So when you are relaxed, when you start to relax those muscles, your body starts to let its guards down. And that's when your brain starts to send those signals that it's okay to open up, to go further, deeper. And that is what gave me my courage to be able to go into a path that would help others out as well. What I had experienced, I wanted to give that. And almost in every class, I want to humbly say this, that I always have students telling me how they felt better, or perhaps they're not. Perhaps sometimes they come and they tell me how they're feeling emotional, and perhaps they need a deeper healing than just that. But that says a lot, that we have to start to connect to our body, to our mind, in order for us to open up our hearts, in order for us to not do it out of competition, not do it because we have to set a goal and we have to reach that goal, but it's out of non-judgment. You don't judge your body in your yoga. You don't judge, or you don't feel that attachment that I have to reach there. It slowly comes when you let your guards down. Of course, you challenge yourself, just like you challenge yourself in life. But this is what increases your resilience. And that's what we have seen in the COVID period as well. In the COVID period, people were going through so many changes. But staying in touch with your practice, it constantly reminded us that you are resilient, that you can stay connected to yourself, and that you can provide a holistic healing to yourself. It's not just about the body, but it begins with the body. But then it goes beyond that.
True, true. Very well said, Isa. Very right that our body has the capacity to heal itself. Sometimes we just have to learn to open the door. We have to open ourselves for healings so that Either we heal ourselves or we let somebody heal us. And thank you again, Isa, for your time. You shared some wonderful information and gave us some wonderful messages in your speech, in your answers. And I'm sure that many would benefit from this, and then many would be motivated to start practicing some of this alternative medicine that we know today. And next time, hopefully, we'll talk about something more in depth. And again, thank you for your time and have a blessed Sunday. Thank you.
Thank you. Thank you for having me. I really appreciate your time.
And ladies and gentlemen, thank you for joining us today. We'll see you next time with another guest. Till then, good night.